what did you bring for us today?
Something very interesting. Today we want to show a case where we did an immediate loading on implants on the lower jaw, cross arch bridge, 16 crowns, everything. In this photo, you can see that using intraoral scanner is gonna be hard job. It will be very, very hard, almost impossible to scan those implants without any different type of methods or help. It's immediately after the implantation. Yeah, you can see you don't have even blood clots. Everything's fresh. You have all in all 6 implants.
This is after the 3 days.
Yeah, this is after 3 days. You can see you have a little bit of fibrin, blood clots. Everything is not bleeding that much. Right now, it's a little bit easier to scan. So we've waited about 3 days, and now we'll change the scan abutments now we'll change the healing caps to scan abutments. You saw previously the multi-units that we placed right after the surgery. We placed the multi-unit and the scan abutment on the multi-unit. On the multi-unit, then we took off the healing caps and we changed them to scan abutments. Now you can see 6 scan abutments. You can see that because it was done 3 days after the surgery, you don't have this large amount of blood. So you can, it will be a little bit easier. The most difficult part in here is the impression taking. If you want to take impression with, for example, open tray with transfers, also it's very difficult because he has a very large tongue. You need to open his mouth very large. It's a problematic case to take impressions. Now, what we chose to do is to connect all the scan abutments with the composite material, the yellow material that you see, it's light curing composite. We connected all these scan abutments, and this way, when we scan, we have one rigid bar that connects all the implants. The scan abutments themselves, when I'll model the teeth, I can use the part of the scan abutment, but when I'm scanning the whole part, the whole bar, the whole assembly of the scan abutment, the composite material. In here you can see the process when we apply composite material between the scan abutments, and we light cure it right away because we want just to save time. You have some time before the material hardens in the syringe itself. So the assistant is light curing and the doctor is applying the composite material.
And this is a procedure, this technique can be, any doctor can do it.
Yeah, you can do it.
Like it's only practice.
Yeah, you can do it also not with the composite material, but with different kind of acrylics or something like this. But with composite material, it's very comfortable. You can do it very fast, and the chair time that you have shortens by quite amount of time.
And it's something that this procedure, like using light curing composite and all these materials, it's something that it's in the latest years. Doctors started using it.
Yeah, because not right now you have a problem with the scanners. With the intraoral scanners. Yes, this video is real time. We didn't make it any faster or something. Now it's even a little bit slower. But what we want to show is the whole process takes about 1 minute.
But you save chair time for at least half an hour.